Hi, I'm Dr. Brittany Bankson with Airrosti Rehab Centers. Today we're going to talk about pregnancy-related low back pain. Did you know that 50% of all pregnant women will have some low back pain or discomfort in their low back? If that's you, these stretches and exercises can help. Let's get started. The first stretch we're going to do is the hip flexor stretch. We like to do this with pregnant women because as the belly grows, it takes our pelvis, pulls it forward, which can tighten our low back. So we want to release those hip flexors. To do this, you're going to need a chair or something sturdy you can hold on to. We're going to get into a half kneeling position. The knee that is down is the side that we're stretching. So we want to get into a pelvic tilt. To do this, squeeze the glute on that side, and that's going to allow you to rotate your pelvis backwards, feeling that tug or that stretch in the front of your hip and a little bit into your thigh. Hold this for a minute to a minute and a half, and then switch sides and do the other side. You can do this in sets of 2, twice a day. For the next stretch, we're going to do a seated piriformis stretch. So you're going to need to sit in a chair, scoot to the edge, and then on the side that you're going to stretch, you're going to take that side, bring the ankle up to the opposite knee, kind of in a figure 4 position. You should feel a nice stretch in the back of that hip and into the low back. If you don't, you can lift up tall and slightly hip hinge, and that should intensify the stretch. There shouldn't be any pain, just a stretch. Hold this for a minute to a minute and a half, then switch sides. You can do 2 sets twice a day. The next exercise we're going to do is cat camel. So you're going to need to get onto the floor in the tabletop position. That means hands and knees. We're going to arch our mid back up towards the ceiling like a cat, hold for a couple seconds, and then let's release that back down towards the ground. We want to try to minimize the arch in the low back though, so kind of come into a neutral spine position. And then arch back up towards the sky, hold for a couple seconds, and then back down. Make sure you're breathing the entire time, and make sure to not have too much tightness in the belly. Repeat this up and down movement for about 30 seconds, take a break, and repeat it once more. You can do this 2 to 3 times a day. For this last exercise, we'll be doing a seated glute squeeze, or clam. The reason why this is so important, especially for pregnant women, is as we progress in our pregnancy, our ligaments get loose, our joints get a little bit more mobile, so we need to harness that flexibility by strengthening these big glute muscles, which is a big stabilizer for the low back. Okay? So you're going to need a chair. You're going to sit into that chair on the edge. If you have an elastic band, you can wrap that around your knees. If not, we'll be showing a version with just your hands. For this exercise, we're going to rotate our pelvis back by tucking our tummy as much as possible, and then we're going to squeeze our glutes. Simple as that. You're going to hold for about 3 to 5 seconds and then relax. And then we're going to squeeze our glutes again, hold for 3 to 5 seconds, and then relax. Applying a little bit of resistance against that band as if you were pushing your knees apart. Now, if you don't have that band, simply put your hands to the outside of your knees and push against the resistance of your hands. Again, holding 3 to 5 seconds and then relaxing. We recommend doing 2 sets of 10 with a 3 to 5 second hold, and do this twice a day. We hope this video was helpful. If you or anybody you know is experiencing low back pain or any other pain, please reach out to Airrosti. We would love to help. We have in-office as well as telehealth options. And if you want to check out any other videos, click up here and don't forget to subscribe. See you in the next video.